Brandy Riffe. I am going to be doing a ivpb back and med push. So with this, I would do my general principles and safety practices, doing my 11 rights and 3 checks, using my 2 patient identifiers, assessing my patient's allergies. Also, I would assess the medication compatibility, as well as what is already hanging and for my patient, and then between the medication push as well as what I'm getting ready to hang, and seeing how that goes, or seeing how that is compatible. Everything is compatible. My patient has no allergies, so we are all good. My patient is who they said they are, and this is the right medication. Everything has been verified, so we are good to go. Their IV is currently running, so I'm going to start with my medication push. So I'm going to perform hand hygiene, and I am going to don a pair of gloves. I am going to get the alcohol prep pad, and I am going to get the needleless port closest to my patient, and I can pause the fluids that are running, and I would get a alcohol prep pad and scrub the hub, keeping that clean. I would get a flush and I would flush, assessing the site, making sure that there's no infiltration, making sure that it flushes well, that everything is still running, and that it is all, that anything that was already in my line is ran through. And then I will take that off, keeping my hub up, get my medication, get another alcohol prep pad, and I am going to scrub the hub again. I am going to take the cap off of my medication, and I'm going to screw my medication on there. I am going to slowly push my medication at the rate ordered by the doctor. So slowly push, the watching and assessing the site, making sure that my patient is doing okay with the medication being administered, making sure that the IV site is maintaining it well as well. Keeping it slow and just maintaining that everything is going in well. Seeing that that all flush well and that there's no, that all the medication is now in the tube, or in the patient and in the tube, I'm going to get another alcohol prep wipe. I am again going to scrub the hub, get another flush, and I am going to put this flush on, and I'm going to use this flush at the same pace that the medicine was ordered, making sure that any medicine that was left in the tubing is flushed into my patient, making sure that this site is still being maintained well, making sure that everything is well, there is no infiltration, and everything is going as ordered. Everything is good. I would take that off. I would get another alcohol wipe. I would scrub the hub, and I would put on my antimicrobial cap, keeping that. I would then discard of all my syringes in the appropriate location. And I would take off my gloves, making sure that my patient is doing okay and everything is going well. At this point, if everything is fine, then I could restart their original main IV and make sure that that was running at the original rate and that everything is going well, and I can come back and reassess my patient. And then I can report and record. Or for hanging the piggyback, I will lock that for a second. I'm going to perform hand hygiene. Okay. Now, I'm gonna spike my bag and get my tubing ready. Oh, I'm not gonna lock that. I would have that running at the rate that was ordered. I'm going to get my, I would report and record about the med push. I'm going to get out my secondary tubing and my piggyback and get these ready. And I would take my primary bag and I'm going to lower it down so that it stops dripping. And I am going to get ready to spike my bag. And so to spike my bag, I would use, keeping the aseptic technique, I would use a push twist method. Not touching the end, letting my canister, my drip canister fill halfway, and I'm gonna let that hang here, allowing my tubing to fill, twisting the end just enough so that I can let out any air and let it drip so that I know that the tubing is filled. But trying not to lose very much medication. So that is good. So I'm going to lock this one. I'm going to hang this up here. I am going to get my flush. I am going to scrub the hub closest to my primary bag. Oh, before I scrub that hub, sorry. I would do my hand hygiene. I'm going to don my gloves. I'm going to remove the cap. I'm going to open my alcohol pad. I'm going to scrub the hub. I'm going to open my flush, keeping my hub from touching anything. I'm going to flush my tubes, assessing my IV site, making sure that everything is well. Everything is. So now I'm going to scrub the hub and attach my piggyback, keeping the end sterile. I'm going to insert that and twist that on, making sure that that is not twisted or tangled in any way. Unlocking it so that it is flowing at the rate ordered, and assessing the site, making sure that there is no infiltration, making sure that my primary is not dripping and that my secondary piggyback bag is. Everything looks good. My site looks good. My patient is maintaining that they are good. So I could take off my gloves. I would do hand hygiene. I would report and record, and then I could get ready and come back in and assess my patient when time has come. And I would get ready to remove my piggyback. So to remove my piggyback, I would don a pair of gloves, or hand hygiene. I'm going to don a pair of gloves. I'm going to make sure that the solution has all ran through like it was supposed to. I am going to lock the secondary line. I am going to untwist the secondary line, removing it. And I am going to scrub the hub of the needle support, and I'm going to apply a antimicrobial cap on my primary line. I can discard of my secondary bag and rehang my primary, making sure that it is running at the original ordered rate, and making sure that it is flowing well, making sure that there is no infiltration at the site, making sure that my patient is maintaining that everything is well. Everything's well and going good. So I could remove my gloves and I can do hand hygiene, and I can report and record.